A significant public health alert in Tshwane as the city grapples with a spike in typhoid fever cases. The latest figures from the National Institute for Communicable Diseases, or NICD, confirm that the City of Tshwane has recorded a total of 48 laboratory-confirmed cases of typhoid fever since the beginning of the year. The majority of these cases are concentrated in two clusters, Bronkhorstspruit and Hammanskraal. Amid public concern, officials have moved to address fears about the city's infrastructure. The Ministry of Water and Sanitation has categorically stated that the outbreak is not linked to Tshwane's municipal water supply. Instead, the disease, which is spread through the ingestion of contaminated food or water, is being investigated as a possible result of a persistent or point source infection within the affected communities. The Gauteng Health Department is urging residents to remain vigilant, practice strict hygiene and seek immediate medical attention if they experience symptoms like fever, headache or gastrointestinal distress. Here to give us an update on the rising numbers and more, we're joined by the National Health Department spokesperson, Foster Mohale. Foster, good afternoon. Thank you so much for your time. Really do appreciate it. What resources and efforts are being mobilized at the moment in the city of Tshwane to contain the spread of this typhoid fever?
Good afternoon to you and good afternoon to your viewers at home, and thanks for this opportunity. Yes, we can confirm the numbers that you've just announced from NICD, but also we need to clarify that these 48 cases, laboratory confirmed cases, they span from January until now, meaning that on average it's about 1 or 2 cases every 2 weeks. But we don't take that for granted as the Department of Health and working together with the NICD and the affected municipality, which is Tshwane District, Tshwane Metro Municipalities. Hence, we intensify public awareness in order to empower the public with health, interrupt the transmission of this preventable disease. But also, it's very important to say, based on Tshwane and Water and Sanitation Department ruling out the possibility of water treatment supply or plants as contaminated. So therefore, we say we cannot rule out the possibility of imported cases, meaning that the source might be coming from somewhere else. Hence, we want to say, while the investigations continue, it is very important for us to intensify public awareness, because in order to prevent further infections.
Yeah. How has the department been able to rule out the water supply of the city of Tshwane as a possible cause for this? What are the underlying data points there?
Yes, no, look, that's why, as we said, just like the water and sanitation, when they said, based on the current investigations, there's no contamination of water. Therefore, we widen our net because there are many possible causes of
contamination.
The issue of proper food handling, the issue of
I hear that.
lack of sanitation in other areas.
Yeah, Foster, I hear that. Yes. There are multiple possible sources. Yes. I'm merely asking, how has the department been able to rule out water as the source of contamination?
Look, we cannot entirely rule out the water, but as the other stakeholders say, based on their current investigations, there's no any evidence to suggest that this contamination of water treatment plant, maybe the water might be contaminated from the dams, from the rivers and other sources of water where people depend on to collect water for usage in their areas. Hence, we say if the water treatment plants are not contaminated, let's try to widen our net and try to look out for other possible sources of water, not necessarily limiting ourselves to water treatment plants.
Yeah. So earlier on you ruled it out, now you don't rule it out, but you also then say it is certainly not as a cause of the water treatment plants. How are you able to determine that if investigations are still ongoing?
Remember, during the investigations, there should be the preliminary findings. So I don't mean the investigations have been concluded, but the investigations are ongoing. But we also have to trust those who are responsible for investigations. If they say the preliminary investigations don't suggest any contamination of water plant. We cannot counter them unless we've got the evidence to counter them. So hence we say, as the Department of Health, we have got an obligation to ensure that we empower our public with health education in terms of preventative measures, because the issue of investigations falls under other public entities, not squarely on the Department of Health. Health will deal with the consequences of contamination or any social determinants of health. Hence, we say we don't want to judge, we don't want to guess the findings of other entities, but our role is to ensure that we disrupt further transmission. We encourage anyone who experiences any typhoid-related symptoms to present themselves.
Yeah, Foster, let's double click in on that. How are you disrupting as a department the further spread? How are you containing this and mitigating the spread?
Look, with the activities that we embark on, number one, we conduct what we call case finding, meaning that we identify all those who tested positive and interview them in order to collect data in terms of travel history and other places they visited. Number one. Number two, also try to get the list of people that they've been in close contact who might have been infected as well, in order to establish what we call epidemiological linkage, meaning that the connection between those who tested positive and the people that they were in contact with. That's number one. Number two, we conduct what we call contact tracing. Contact tracing, we identify and notify all people who have recently been in contact with those who are diagnosed with typhoid, and we screen them for any symptoms in order to prevent new infections and also to break the chains. Lastly, we conduct what we call surveillance. Surveillance entails collecting and analyzing data about the disease and monitor the trends of the outbreak.
Yeah. And just finally here, what support are being given to those who are currently on the active cases registry? And secondly, and importantly here, how many active cases are currently known of?
Remember, as we've indicated, also I clarified from the beginning that we should not look at this total number of 48. Some of these cases were detected in January, others in February until now. So others have already
but how many active cases are there now? What we know to be now, those who have recovered obviously are not active cases. How many active cases are there now?
Majority of these cases have recovered. They were in self-isolation because only fewer cases experienced severe symptoms which required them to be isolated and monitored in hospital. So far, I don't have the exact number with me, but I can assure you and the viewers of SABC that so far the situation is under control. There's no need for public to panic. What's more important is for anyone who experiences any typhoid-related symptoms not to self-diagnose, not to self-treat, but present themselves to the nearest healthcare facility so that healthcare workers will be able to screen and test them. If they suspect that they might be infected, then they'll collect the stools for laboratory testing.
Yeah, we're going to have to leave it there. Foster Mohale, thank you so much for your time. Really do appreciate it. That is the spokesperson for the Department of Health.